Hi, I'm Dr. Isaac Alexis from the Slim Samurai Media Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Today's topic is Doctor, my fingers turn blue in the cold. Doctor, my fingers turn blue in the cold. Before I continue, don't forget to subscribe. Click on the notification bell. Like, send to 25 of your friends. Comment in the comment section below so I know what to discuss for future topics as well. Let's begin. I often get asked lots of times in the fall time, winter time, Doctor Alexis, my fingers are turning blue. When it's cold outside, it's painful. I ask them, how painful is it on a scale of 1 to 10? 1 being low, 10 being high. Lots of times they say, Doc, it's 10 out of 10. It's unbearable. So I look down and I see, sure enough, their fingers is alternating between being very pale and then being on the border of then becoming blue in color. So the patient rubs both hands together to no avail. It sometimes makes it worse when they try to blow warm air on it, and that doesn't seem to help. If it does, it's very little. I get cases like this at least 20 times a week. And so we're going to discuss in today's video what really is the best way to get this evaluated and then treated. We'll also look at some of the clinical evidence of what really causes this. And so without any further ado, let's begin. So this condition where you see the fingers turn blue, initially they are pale and then progress to becoming blue, being painful. Well, what this is commonly referred to is Raynaud's phenomenon. Usually it has an onset between the ages of 15 through 30. It's more common in females, but it's not exclusively in females. Let me repeat that again. Even though it may be more commonly found in women, it's not going to be exclusive only to women. I've also had gentlemen with Raynaud's that have the same symptoms. It's blue, the fingertips painful, it's pins and needles, numb, and very uncomfortable. And I prescribe the treatment that I'll discuss at the end of this video. So I need you to stick with me to the end. Now, even though Raynaud's is more common in females, it may also occur in multiple related family members as well, so a genetic component. Although primary Raynaud's phenomenon occurs generally in healthy individuals, there are comorbid conditions that may exacerbate attacks, which include hypertension, atherosclerosis, hardening of the arteries, diabetes, cardiovascular disease. Now, let's look at some of the evidence. A meta-analysis of observational studies found that risk factors for primary Raynaud's phenomenon included female sex, family history, occupations that involve using your hands a lot, whether female or male, smoking, and a history of having migraines. Now, you may be asking, Dr. Alexis, what is the cause of my fingers turning blue in the first place? Well, my samurais and my samurettes, that's an excellent question. Now, it is thought that Raynaud's phenomenon emanates from vasoconstriction, narrowing of the arteries in your fingers and fingertips. Now, there was a study done by Dr. Fagius and Dr. Blumberg, and it has been demonstrated that sympathetic nerves activity during cold stimulation is similar in Raynaud's patients and healthy subjects. However, there is overactive sympathetic tone. Sympathetic nervous system, you remember from grade school biology, is the fight or flight response. Now, it was thought that overactive sympathetic tone in individuals with Raynaud's phenomenon was dominant. However, there's growing evidence that the vasoconstrictor response to sympathetic stimulation is stronger in Raynaud's phenomenon patients than in healthy controls, based on a study by Dr. Wigley back in 2014. Now, very important, I want you to listen to this very carefully, my samurais and my samurettes, as it's very important to understanding what causes this. Now, there are certain specialized receptors that are in your fingertips. There are alpha 1 and alpha 2 receptors in the body all over. They are present on the blood vessel, smooth muscle walls of arteries in the human extremities, fingers, toes. However, having said that, the alpha 2 receptors are much more numerous on distal arteries, like the arteries of your fingertips. Now, in a study done by Dr. Cook and Dr. Wigley, this is explained by the findings that cool, sensitive alpha 2 receptors make up a significantly stronger contribution to vasoconstriction in Raynaud's patients as compared to healthy subjects. Now, the next question you may be asking me, all right, Dr. Alexis, thanks for sharing that information, but how in the world do I treat this? It's hurting bad. My fingertips turn pale, then they turn blue. I smoke a pack a day. I smoke 2 packs a day. I don't exercise. I eat high processed foods. Well, I would say stop the smoking, bring it down. Even if you decrease by 2 cigarettes per week, you are moving in the right direction. But while adjusting for diet, exercise, and trying to stop your cigarette smoking, there's a medication, amlodipine, a calcium channel blocker, used to treat high blood pressure, used to treat patients that have angina, coronary arteries that clamp down, decrease oxygen and blood supply, freshly oxygenated blood going to the heart muscle. Well, that also is used to treat Raynaud's phenomenon, where you have blue fingers. The fingertips are pale, blue, and painful. What I refer to as the PBP triad, painful, blue, and pale, the PBPs. Now, let's look closely at amlodipine, which is a calcium channel blocker. Amlodipine, like I told you, it's 5 milligrams once a day. Amlodipine directly acts on the vascular smooth muscle to produce arterial vasodilatation. This is vasoconstriction. This is vasodilatation. So it's going to open up those blood vessel walls for you very nice and very conveniently, my samurais and my samurettes. It also reduces peripheral vascular resistance. That's very important because I want that fresh oxygenated blood to go where I need it the most, to give me oxygen, to give me tissue perfusion, and to decrease that very painful fingertips. I want to reverse that pins and needle sensation that's a 10 out of 10 or a 9 out of 10 that can last many times for days in a row. Patients can have the pain. It may last 5 hours, 6 hours. No 2 patients are the same. What happens in John may not necessarily happen for Jill. And so the amlodipine works in that way to help with vasodilatation. Now let's look more closely at the actions of amlodipine, because it has multiple effects, not just on the fingertips. Interestingly enough, amlodipine stops calcium ions, these charged particles of calcium, from entering what's called slow channels of vascular smooth muscles, looking at the heart tissue. And what happens? Heart muscle during depolarization, which produces coronary vasodilatation. Instead of your coronary arteries being shut, coronary vasoconstriction is what it's called. I get this nice process of coronary vasodilatation. Coronary arteries open up. I get fresh oxygen, fresh nutrients, fresh blood supply to the coronary musculature. And as a result, I will now get increased oxygenation of my heart muscle. Now I will have a decrease in chest pain. Patients that have vasospastic angina, they'll have less symptoms. Of course, you're going to be on nitrates as well. That's going to also help open up the coronary arteries, enhancing coronary perfusion pressures, and you're going to experience less pain walking up a flight of stairs. Patients I've seen have less chest pain walking up 5 steps. Now they can walk up 25 steps and come to my office and no chest pain. They can walk a block and experience less chest tightness, pain that's beginning in the left side of their chest, shooting up into their jaw, may shoot to the left eardrum. They complain lots of time. I feel this pain in my left ear. Of course, make sure that they're not having a heart attack. I always get those patients immediately to the ER, get evaluated. But having that evaluated and not having a heart attack, it can be a vasospastic episode where coronary arteries are clamped down, chest tightness, shoots to the left jaw or right jaw. Nothing is ever written in stone. Acute coronary syndromes, no 2 clinical cases are ever the same. Chest pain in the left, shooting to the left side of the face and jaw to the left ear, and then radiating down the left arm. It could also go down the right arm. Those symptoms I see less of with amlodipine if patients had prior history of coronary syndromes or cardiac disease. As always, my samurais and samurettes, we share knowledge here so that we can help you live to age 100 and beyond. I want to see everybody here in the Samurai and Samurette Club live long, healthy, and prosperous. I'm Dr. Isaac Alexis from the Slim Samurai Media Group 84, helping you to slash through sickness and offering you a slice of health and wellness. God bless.